Welcome back to Crown Talks, y'all, your dose of health and healing in Black communities. And in about 15 minutes or so, we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. Now, I don't know if y'all have seen this, but Australia is expected to become the first country in the world to eliminate cervical cancer as a public health problem, largely thanks to the HPV vaccine, screening, and of course, early treatment. In fact, they reported no cervical cancer diagnosis among Australian women under the age of 25 in 2021. So, why are we doing HPV more in this country? Well, today I'm joined by Dr. Brenice Duroseau, who is a family nurse practitioner, and I'll let her introduce herself, but she's going to help us work through the HPV vaccine, why we need it, what we need to do to get it. Hey, Dr. Brenice.
Hi, Dr. Johnson. It's always a pleasure. So just quick introduction. My name's Dr. Brenice Duroseau. I am a family nurse practitioner and current postdoc at Duke University. My work focuses on the social, structural, and political determinants of sexual reproductive health impacting marginalized women. So jumping into what you mentioned about Australia, honestly, it's something I think about all the time because we actually have one of the few vaccines that actually prevents cancer, and not just infections, but actually preventing cancer. And somehow, I don't know why, but it doesn't get the urgency that it deserves. And I think part of it is because HPV being linked to sexually transmitted, the sexually transmitted part. And when people hear about sex, suddenly the conversation just gets really uncomfortable, really murky. But cancer obviously doesn't care about how uncomfortable we are. And I think Australia was able to do a great job normalizing vaccination and screening instead of this whole moralizing of what HPV means. And that's what really helped them get on track to eliminate cervical cancer as like a public health problem. So I think if we move beyond the morals of some of these things and really take a look at our current health infrastructure, we can also get to that point.
I think that's 1000% true, right? I think about Fauci, Dr. Fauci currently being in front of the Senate for vaccines. And we're not going to talk about that vaccine because that gets people all up in arms. But COVID did bring about this heightened sense of vaccine hesitancy that I don't think we had before. Everybody got their shots. You know, you don't have polio because you got your shots. You don't have measles, mumps, and rubella because as kids, you were vaccinated against these things. But now we have this huge vaccine hesitancy that I think may also, I definitely think sex, anytime you hear the word sex, but I also think the vaccine of it all may be contributing. What do you think?
Yeah, no, that's a great point. I think I say post COVID lightly because we're still in dealing with COVID, but when we hear vaccine now, it's so sensationalized and so tied into that era of what was going on with the COVID pandemic, and also with political drivers of some of these conversations and what we're seeing now with Dr. Fauci. And when I have these conversations with patients, I really try to understand where the hesitancy is even coming from, even with certain things like long-acting injectable for PrEP. I always start off by saying this is not a vaccine because I need to be clear as to what we're talking about because that hesitancy is so prevalent. And I think, with most parents aren't really trying to make bad decisions. They're really trying to make the best decisions with the information they have. But with how misinformation spreads right now, it spreads so much faster than science. Social media is literally a cesspool of information. It could be great, but it could also help spread misinformation so fast. So when people hear vaccine and how the larger conversation's happening, they just automatically think about risk. They think about harm. They think about all this political nonsense that gets wrapped up into it, but they don't think about cancer prevention decades down the road. Like that's not the forefront of their mind. So I think we have to do a lot better with how we talk about the science, advance the science. And I think podcasts like this could potentially do a really great job in doing that.
I'm not plug Crown Talks. Okay. So
Period.
I think some people also may struggle. I think a lot of people do know what HPV is, right? But may not know that even though it's sexually transmitted, they don't necessarily know how that links to cancer. Is HPV just as a virus that leads to the development of cancer cells, right? Yeah. So understanding that, I think, is a huge impetus for us moving to and getting out of the myths about it being, though it is sexually transmitted, we know that it carries significant weight in long-term complications and health complications for our family, for girls and our boys, and we'll get into that a little bit too. So with that being said, who should get the HPV vaccine? At what age is it recommended?
Yeah, so the CDC recommends starting at around age 11 or 12, although it could really begin as early as 9. And I personally, this might be a unpopular take. I personally love the idea at starting around 9 because some people could argue differently. I think that completely separates the conversation from sex.
Yeah.
Because as you mentioned with myths, some of the biggest myths I've heard is that the HPV vaccine is somehow going to encourage sexual activity among children, make children somehow promiscuous, which is obviously not the case. But I think when we start this vaccine series, it's the vaccine at 9, it kind of creates that separation, and it just could be treated as another routine childhood vaccine that protects your child from cancer later on in life. When you get into that 12, 13, 14, 15 area, like sex becomes a little bit more forefront in some of the conversations, not promoting it, but let's just be real on how like conversations happen and what's happening with the hormones and puberty. I think parents get a little bit more nervous.
I love that idea. And sorry, I missed the myth. My number one question that I always ask is the myth. So thank you for dropping that big myth of people equating that the vaccine to sexual health and sexual conversation, which they may or may not be ready to have in terms of parents, right? But starting it at 9 does separate it from that conversation. And it's just a protective mechanism for things that may or may not happen down the line.
Exactly, exactly. And I know the naysayers and people online might say, like, well, 9-year-olds are engaging in sexually activity. 9-year-olds can't consent to sexual activity, full stop, nowhere in the world, despite what may be occurring. So we're now going into different territories of sexual assault and trafficking that is completely void of what we're talking about when we're talking about sexual activity. So I always want to be clear with that when I say like the separation. And the younger too, like, they're not exposed yet to the vaccine, which is the opportune time for the immune system to respond. So it's just when we talk about leverage opportunities and best utilizing like time periods, I think it just makes more sense in my opinion.
I agree. Thank you. And another question. So if someone missed getting vaccinated in that time frame, like say their parents are against the vaccine, is it too late to get it later, or when is it too late to get it?
Yeah, no, and I'm a case study of this. So they changed the age from when I was growing up, but I didn't even know the age had increased at one point. So I got it later in life. I come from a very conservative family. My mom's super Christian. So when my pediatrician mentioned the vaccine, it was around, oh, it's to prevent this like sexually transmitted thing. And my mom's like, oh, well, my daughter's not having sex. She's not married. So that was the end of that. I didn't care enough. I was actually like very scared of vaccines. So I was happy not to get another one, not knowing the implications. So I actually got it later in my later years because of that. So if you're under 27 and have not been vaccinated, you could definitely talk to your healthcare provider because it's still recommended at that time. And so for adults 27 to 45, you still also might be able to benefit depending on the circumstances. Like I mentioned earlier about if you haven't been exposed yet, that's like ideal because of your immune response to the vaccine. But it's still a conversation that's worth having because it's never really too late to ask about whether protection still makes sense for you and where you kind of fit in the clinical picture of it all. So at 27 to 45, it's not an absolute no at that point.
Yeah, definitely you should have a conversation with your primary care or your OB or whoever you see most often about that during that age range, but just knowing for sure that if your parents didn't get it for you, or you can make your own choice at some point, it is good for us to know, because I don't think people realize, and would probably be surprised to know, how many people in their lifetime will be exposed to HPV. How common is HPV?
So yeah, that's what really shocks everyone. And I think people also have this conversation inaccurately too, because people will say, oh, everyone has like HPV, everyone like has like HSV, for example. But that's not really the case. So nearly everyone who is sexually active will be exposed to HPV at some point in their lifetime. And like when you think about that, almost everyone, that sounds wild, but it's true. So when we talk about HEV, we're not just talking about like those people over there or those people who are engaging in sex work. We're literally talking about all of us, myself included. So when you frame it that way and you understand exposure does not mean necessarily outcomes, you want to think about like prevention. If you're going to have that much exposures over your life course, what do you want to gift your future self something? What do you want to gift your future self that you'll be thankful for, which would be preventing cancers that may arise out of this exposure?
Yeah. And we already know that Black girls and women are less likely to be screened and have access to care, less likely to be followed up if they get a positive HPV screen, or I actually, one of my students just did a project on that, in terms of how this huge gap between the number of people who have a abnormal HPV screening in their routine PAPs and don't ever get, the subsequent follow up that you need. And so we know that happens, right? But what should our young men also know about HPV?
Yeah, I think it's important that men know that they can also get HPV, that they can spread HPV, and that they can also develop HPV related cancers. Because we talk about this so often in the space of like pap smears, men kind of get left out of this conversation, although we also talk about this from a sexual risk or vulnerability standpoint. And a lot of this is coming through heterosexual contact. And if women are engaging in heterosexual contact with men, I don't know why we erase them in this conversation. So getting vaccinated for men also protects, or boys also protects them. It protects their future partners and their future family. So it's a really everyone conversation, although in the public sphere, it gets very much gendered and exists within a responsibility or thing we need to do to little girls or young adults.
And you and I both work heavily in the HIV space, HIV prevention, as well as you're in HIV treatment as well. But that's one thing that we talk about all the time. Like we gear these things towards girls and women who, of course, do bear the brunt of cervical cancer, and because they are the only ones with the cervix, but they're getting it from somewhere. So we don't do a good job of ensuring that we make sure our boys and young men and men are in this conversation as well. I remember the actor Michael Douglas, when he shared his story of having throat cancer, was HPV related, and everybody was, how to make the jokes and crack jokes or whatever, but it did not seem to be a wake up call to people that HPV related cancers impact men, women, and more than the cervix.
Exactly. And it's a shame because even with the situation with Michael Douglas, it just turned into more misogyny of, oh, this is what women are causing to men. Women need to be removed from oral pleasure because this is what happens when men are offering that, which is absolutely ridiculous and just not true. We need to be having this conversation more broadly, and it's about protecting people's ability to speak, swallow, eat, live healthy lives, all the things. And we don't even know like all the details around like his history or what even occurred. But this is something that impacts gay men. So it's not a thing that like is a pathologizing of women's bodies. It's a conversation we need to have within the constraints of infectious disease and the world that we live within.
Yeah, and so let's talk about what other cancers HPV can actually cause in both men and women. So we know cervical cancer, we know throat cancer.
Yeah, and few people know about, cancers of the vulva, the vagina, anus, penis, cancers of the mouth and throat, like we just talked about with Michael Douglas. So we should not be calling this thing a cervical cancer vaccine. And I know some people do that just because of trying to relate and have the public relate. It's a cancer prevention vaccine. Like, that's it. Like, if we label it as that, especially now when there's a lot of conversation around cancer, that could really spark people's interest and change the way we have the conversation, especially in a world where like misogyny and patriarchy ideas really find women to be expendable, and women's health is an area that's not heavily funded or cared about in a genuine way. So when we remove that cervical cancer piece and just talk about it from a cancer prevention standpoint, I think it might have a lot more reach and potential for impact.
And speaking even more broadly, right? Because HPV is the virus that or one of the top viruses that leads to cervical cancer and other cancer production, but it also is what causes genital warts, what we know commonly as genital warts. And so it goes beyond cancer prevention, and not specifically cancer prevention. The vaccine helps to prevent cancer, right? But what else should we know about protecting ourselves from HPV?
Yeah, so just even keeping up with the screenings, like that's the first step, just making sure you have proper screenings, follow up if there's abnormal results. A lot of people will have these abnormal results, never circle back, kind of poo-poo it away, and practicing safer sex. I think, we have so many tools at our advantage. I think to some extent we have become desensitized to a lot of stuff to where it's like, oh, we could just get that treated, so it doesn't even matter. We don't think about like the long-term impacts on like our immune system, our mental health, the stigma around living with certain infectious diseases, although we need to destigmatize a lot of these things. And also things like smoking, because smoking could even make it harder for the body to clear HPV infections. A lot, like now I see so many people vaping and smoking and just, I don't even know what is the uptick of that. That's not really my area. But just, overall, I just think don't avoid healthcare because you're embarrassed or because of the things. Like, find ways to still access the things you need and also incorporate, healthy habits in all things that you do, including sex, and including what you eat and what you intake into your body.
Yeah. And I think you already kind of answered this question earlier, but because healthcare providers, we always want to shout out the healthcare providers that are doing the work day to day and trying to engage patients with their routine maintenance and care. But how do you think it's best for them to engage this conversation to one of a assets based? I know you talk a lot about, from an assets based conversation versus a uncomfortable one.
Yeah, I think we need to stop asking permission to prevent cancer and to have some of these conversations, because providers sometimes will present things like, would you maybe be interested in this? Or are you interested in XYZ? Instead, we should sound just like any other routine vaccine. So you could say things like, today your child is due for the HPV vaccine. It protects against several cancers, and we'll give the first dose today. Do you have any questions, concerns? And that way you leverage the authority and the facts around what we know about the science. We're not leaving it up to the patients who may be not having the accurate information, who may have misinformation. And, we understand like the power dynamics when it comes to influence in multiple ways, but we sometimes don't leverage that in a setting where we are the experts, we are the people with the knowledge from a scientific standpoint, and try to bridge that gap between what patients know about their bodies, what they want for their families, and what the science says and what will help with the most optimum outcomes. So just having some matter of factness, no awkwardness, removing some of the stigma and the bias in our own language could actually help parents appreciate and actually have interest in getting their children vaccinated. And I think our paper, the 8Ps, I'll shout that out, gives some tools and language around sexual history taking and having some of these harder conversations. And so even our risk to reasons paper, I think also helps gives providers some language to move beyond some of the stigmatizing language like risk, especially when we're talking about underage patients, for example, when parents are making the decision. I think highlighting the vulnerabilities of adolescents, which is a true vulnerability that I think parents could appreciate, could also be a tool that providers leverage to really have some of these conversations that might be uncomfortable.
Yeah, I think those are great examples, and I'll be sure to link our paper in the show notes so people can read it and think about how that can help them. And before we get out of here, I want to thank you, thank you, thank you. But before we get out of here, one final question. If a parent has been hesitant about getting the HPV vaccine, what's one thing you'd want them to know before making that final decision?
Yeah, I think one, acknowledging the realities of hesitancy and wanting to do the right thing for your child is important. But I would simply ask them this: if there were a safe way to lower your child's risk for developing several cancers decades from now, would you at least want to learn about it? So, starting from, are they even receptive to information? And that's really, I think that would offer them an opportunity to see what the vaccine actually offers. So, as a nurse practitioner, I've never met a parent who hoped their child would one day face cancer. But I've met plenty who just needed more accurate information instead of fear. A lot of parents get like frozen in decision making. Like, it's so many decisions you have to make, especially first time parents or first time teen parents. They want to do the right thing. And it's our job really to help facilitate that decision making rooted in accuracy and what the evidence says. So our job is never to pressure people. My outcomes of success is never just a person getting a vaccine. I want all my patients to at least have the information and to be making informed decisions, even if that decision is not necessarily what I want, because I do want people vaccinated. But even if they're making that decision not to vaccinate, but they have the information, I could rest knowing that they are informed in their decision making.
Yeah. Thank you so much, Dr. Duroseau, for being with us today.
Thank you. And thank you for facilitating this. I'm a, huge fan of this podcast. And I think these are the novel ways we need to really spread information and have these conversations among each other. And hopefully where the public could see we're just everyday people just chatting it up and just really passionate about this work because it is very important. So thank you and congratulations on the success of this podcast.
Thank you. Now, everyone, this has been your health check-in with Crown Talks. If you love this, follow us on social media, share with somebody else that you think needs to hear it, and subscribe to Crown Talks with an X, CRX, Crown Talks, wherever you get your podcast medicine. Consider yourselves Black, healthy, and crowned. We out.